Although a bone marrow transplant may be your best treatment choice, you may or may not be a candidate for transplant. The reason is, many patients who want to have a bone marrow or stem cell transplant have been previously treated with chemotherapy, radiation therapy, or may have other existing health issues. These treatments can damage organs such as your heart, liver, or kidneys. The treatment you receive to prepare for transplant may cause additional organ damage. Before you are approved for transplant, a complete history of your health and a number of important physical exams, medical tests, and evaluations will be done. This helps the transplant physician evaluate the risks and benefits of you receiving a bone marrow transplant. These tests will also create a baseline from which tests can be compared to after your transplant. If you are receiving chemotherapy, the baseline tests will be done about 1 to 3 weeks after your last treatment. Depending on the type of disease you have, your transplant workup may include the following: blood tests to determine your blood counts, liver and kidney function, and any present or previous exposure to various infectious diseases. These tests are also used to do human leukocyte antigen typing. Chest and skeletal survey X-rays. These are special X-rays that look at your lungs and bones for diseases. CT and PET scans. 2 types of X-rays that check your head, chest, abdomen, and pelvis for disease. MUGA scan, a nuclear medicine procedure or echocardiogram that measures how effectively your heart pumps or functions. Pulmonary function test, requires you to breathe into a machine that checks the condition of your lungs. Bone marrow biopsy and aspiration checks your marrow for disease and determines its quality. Spinal tap checks the fluid which surrounds your brain and spinal cord for the presence of infection and disease. Dental exam looks for decayed teeth and any gum concerns that could be a source of serious infection if you are having a bone marrow transplant. And 24-hour urine tests, which measures kidney function. Your bone marrow transplant coordinator will make every effort to schedule several tests on the same day for your convenience. A calendar of your appointments will also be provided to help you with the scheduling process. The transplant physician will then review your information to decide if you are medically fit to undergo the bone marrow transplant. It is very important that you understand the risks and benefits of receiving a bone marrow transplant before you decide to go ahead with the transplant procedure. All approved transplant candidates must be willing to follow a strict medical program and a consistent physical rehabilitation schedule both before and after transplantation.